So hi there, how's it going?
Hi, how are you? Everything's going well. Living by our motto, laugh frequently, smile proudly.
Alrighty, so how's the day coming along today?
It's going well. So far, so good, I'd say. Yeah.
So tell us about the Twintists.
We are twin dentists, hence the name of the Twintists. Our social media presence is all about positive representation, spreading dental health awareness, and lifestyle inspiration. Let's show you around.
So how did you come up with the name Dual Image for your practices?
So we are very intentional about our names. The name Twintists comes from us being twin dentists, and even our practice name Dual Image was intentional. Dual Image has many different meanings. For one, we're twins, essentially we're a dual image. Yeah. Even our logo is a representation of the dual image. As you see, it's a tooth, but it has two faces in it. Dual Image also represents the transformation you'll experience as we enhance your less than perfect smile. And we're a dual practice. We offer both orthodontics and general dentistry.
The name is perfect. What is your practice philosophy?
Making people smile. We find joy in everything we do, and we'd love to be a source of joy in people's lives.
Tell us about your dental practices.
Yeah, walk with me. So we're going to go into this space here. This is just a consult room. It's very lovely. It's a nice sunroom. We love bringing patients in here to talk about treatment. But the history of the practice is that Dr. Lauren and her husband, the orthodontist, they opened up a practice in 2015 called Dual Image Orthodontics in Charlotte, North Carolina. And the three of us came together to open up Dual Image Dentistry and Orthodontics. That's where we're touring today. In 2021, we opened up another practice called Dual Image Dentistry. And that is about 5 miles from the others, but we offer cosmetic dentistry and general dentistry at that location.
So, what is your vibe?
Ooh, caring and professional, family-oriented and fun. In fact, our motto is, let our family treat your family.
So what type of patients do we have?
Our practice is truly a reflection of the community. We see patients of all different socioeconomic statuses, demographics, races, and genders, and even our staff is a true reflection of the community. I treat a wide range of conditions. I'm a general and cosmetic dentist, so I do anything from fillings, crowns, bridges, root canals, veneers, partials, dentures, extractions, implants. We see a lot. We keep most treatment in-house as well.
What conditions do you treat, Dr. Lauren?
Our orthodontic cases consist of a wide range of folks with malocclusions, whether it be crowding, spacing, cross bites, open bites. Sometimes people also have malalignment of their jaws, which requires us to work with an oral surgeon. My husband and I are both board certified orthodontists, so we love working with these type of complex cases. So now we're walking into our hygiene room. This is one of our spacious, lovely operatories. All of our operatories are quite large. It's probably larger than the average dental practice you'll see. This is where our hygienists will clean people's teeth. So as you can see, state-of-the-art equipment, new, beautiful, lovely, clean equipment. We practice in a nice, hygienic environment. And all of our chairs actually massage. So while you're getting your teeth cleaned or your teeth worked on, you could even get massaged during that.
So is there any competition between you two?
That's a good question. I'd say we push each other to grow. Wouldn't you say? I agree with that, yeah. Healthy competition.
You two grew up here, right?
That's right. Born and raised in Charlotte, North Carolina.
That's right.
We have no plans on leaving.
Okay. So who's older?
I'm older. I'm 11 minutes older.
Do you guys share the same interest?
Mainly, yes. We actually are interested in a lot of the same things, being identical twins. So I would say, yeah.
What are you guys' hobbies?
Oh, well, as of late, actually, a lot of our hobbies have been creating videos. That's right. We love to inspire and educate our patients, so follow us at the Twintists on our social media pages. And now we're walking into another lovely, large, spacious operatory. In this room, we do a lot of orthodontic cases. We have a large TV here that helps us project the patient's images onto the screen to show them what their cases will look like before we start, and then we can show them after we're finished. This treatment room is so large. This is where we love to place our implants or perform root canals because there's just so much space in this room.
So what is the biggest thing that sets you guys apart professionally?
Well, I, the orthodontist, am a board certified orthodontist. Dr. Lindsey is a cosmetic and general dentist. And I'd say the biggest thing that sets us apart is the ability to treat cases in a professional and caring manner. Absolutely. Yep, that's right. Actually, our motto is let our family treat your family. And we treat our patients and our staff that way. Let's walk down this hallway to check out some more rooms.
You guys come from a family of doctors, right?
Yes, that is correct. Our father is a family physician. Our mother is a registered nurse. Our sister is a dental hygienist. Dr. Lauren and her husband are both board certified orthodontists. I am a general dentist, and my husband is a doctor of physical therapy. This is another room here, another state-of-the-art room, very large and spacious. This is another one of our hygiene rooms. So this is where one would get their teeth cleaned and enjoy a nice massage along the way.
So who decided to become the dentist first?
Although we had similar timing, I would say that it was Dr. Lindsey who came up with it first. Our older sister's actually a dental hygienist, so maybe there was some inspiration there, but she came up with it first.
Did either of you need convincing?
No, I think
Not
we
much.
always knew we wanted to get into healthcare. Coming from a family of healthcare providers, I think we always knew we wanted to be in a career where we could help people. And what is better than helping people smile beautifully?
That's right.
What's your favorite thing about being an orthodontist?
Ooh, my favorite thing about being an orthodontist is being able to just change people's lives just by transforming their smile. My husband and I joke all the time that some of our patients have gotten job promotions, some have proposed to their fiance, to their girlfriends. So we're really changing lives out here.
That's right.
Dr. Lindsey, what is your favorite thing about being a dentist?
I love being a dentist because I get to do a little bit of everything. You know, I'm great with my hands, so I can really create and build and really keep smiles healthy and beautiful.
Dentistry is a combination of art, medicine, and science. Were you each science majors in college?
Oh yes, I graduated summa cum laude from UNC Chapel Hill. Dr. Lindsey graduated magna cum laude from UNC Chapel Hill, both with a Bachelor of Science, or BS degree in biology. So I would say, yeah, we do have scientific background, and our artistic side actually comes from our mother. She's a magnificent artist. She can actually take a look at a picture of somebody, draw it, and it will look just as realistic as the person.
Who's more creative?
I think that's a great question because we're both creative. I mean, we both have strengths. I mean, anytime you take two people in society, one is going to be stronger at the other. You know, there's no two people that are exactly the same. So I think that's what balances us out well, is that I'd say Dr. Lauren may be more linguistically creative, whereas me, Dr. Lindsey, I might be a little more visually creative.
I agree with that.
Yeah.
Any special accolades, Dr. Lauren?
Yes, actually, I was the first African-American female to graduate from my orthodontic residency program back in 2013. Also, I'm a board-certified orthodontist, which is an honor that not all orthodontists have.
That's right.
Any special accolades, Dr. Lindsey?
Yes, my research on breastfeeding and its oral benefits was featured on the cover story of the renowned Journal of the American Dental Association back in 2011. Let's tour this side of the office too. So this is our orthodontic hallway. This is our first operatory where you would get braces, you would get your Invisalign put on, or your dual line, which is our in-house clear aligners. This is the room that we do that out of, and as you can see all these colorful rubber bands to choose from too. And I'm going to take you to the next operatory too.
How is it working with your twin sister?
Oh, we enjoy working together. Yeah, we have a lot of fun together. Sometimes we'll have lunch together, but we love each other, trust each other, and communicate well with one another. So it's a lot of fun.
Yes. And actually, I'm going to show you this cool device here. As I mentioned, we have state-of-the-art technology. This is an iTero scanner. This is what we use when we need a model to make the patient's orthodontic trays. So as you see, we can see the patient's full teeth, their upper and lower teeth. We can isolate it to the lower arch or see both at the same time if we want to look at how their teeth are coming together. And this really allows us to have a 3D representation of how we're going to treat our patients. So we love all of our state-of-the-art equipment. We even have 3D printers to help us print our models and our clear aligners that we do in-house.
Fun fact, Dr. Lauren?
Oh yeah, we were actually the winners of the 2014 Family Feud game show back in 2014. We were on 2 episodes, and the episodes actually still rerun, so we get texts a lot from patients who see us on TV. And also, I was Miss North Carolina Homecoming Queen back in 2003.
Fun fact, Dr. Lindsey?
Yeah, so I'd say our fun facts are kind of intertwined, but most recently we had a very viral video. It had about 40 million views across all of our social media platforms, and it's still going strong. So I think that's very fun, and that's why we do what we do as well, positive representation. So I'm going to tell you what room we're standing in. This is our panoramic room. This is where we'll get an x-ray on our patient. This is also a cone beam. beam. So if we're placing an implant, we'll use this technology to help us map out where the patient's nerves are, how much bone they have in preparation for their implant placement.
How can our audience today reach you?
Oh yeah, follow us, message us on Instagram, TikTok, Facebook, and YouTube at the Twintists. Thanks for tuning in.